Let's talk about why there's mercury in dental fillings. Hey guys, I'm Dr. Jaclyn from Dental Designs Clinic in Singapore. I'm a general dentist. Let's talk about why there's mercury in dental fillings. Mercury is found in a particular type of filling material known as amalgam. So amalgam is a mixture of different metal particles which are dissolved in mercury because mercury is a liquid at room temperature. When you mix it, eventually the mercury releases vapor, and that's what makes the filling harden. So historically, amalgam was developed as a cheaper alternative to gold foil fillings, which was the first type of filling material that was developed. But not everyone could afford gold, so amalgam was developed as an alternative. And the main benefit of amalgam is that it's pretty cheap to produce. It's quite tolerant. So for example, if you have saliva or blood in the area of the filling that you're working on, it doesn't affect the setting or the performance of the amalgam material. So that is the historical context behind amalgam. But maybe in the past 10 years, the World Federation of Dentists, or FDI, they actually came together to release a statement saying that they're going to phase down amalgam fillings, not because of any health reasons, but for environmental reasons. Because when we are done using the amalgam material, there's usually some excess material that has to be disposed of. But because there is mercury in that residue, we cannot just dispose of it with our regular rubbish, otherwise it will contaminate the groundwater. So the decision to phase down amalgam is more for environmental concerns around the disposal of the residue. In Singapore, the Ministry of Health has also echoed the findings of the FDI in that we are phasing down the usage. Of course, there are still concerns from patients. If say they have amalgams that have been placed many years ago, is your health at risk? It is not. Of course, there have been studies to show that if you have silver, or as what patients call them, amalgam filling in your mouth and you're chewing on it, small amounts of mercury vapor is released, but there has been no study to date showing that this is actually going to have an adverse effect on your health, because the amount of mercury vapor that is produced during chewing is just so low. I feel that the fears around mercury are quite unfounded. Of course, since the Minamata Convention was written, most countries are quite diligent about handling mercury safely. If you have an existing amalgam, I wouldn't panic and rush to your dentist to get it removed. It's again down to what's happening with the filling. So if the filling is intact, but you don't like it, of course you can have it removed. The removal process does release some mercury vapor, but usually it's managed because we drill it out with water, so the water particles actually trap the vapor inside a little cloud, and we also use appropriate suction to really catch most of the mercury vapor. That's definitely something that you can consider. And like I said, nowadays most clinics in Singapore, we would not be placing new amalgams just because we're trying to phase down the usage of this material for environmental concerns. As always, this is a discussion that you have to have with your dentist. If you are concerned that you want to have your amalgams replaced, what material will be the best choice to replace them? We would always be happy to discuss that with you. Amalgam is a very safe material, but it's being phased out for environmental reasons, and it was useful in the past as a historical material, but it's not a material that we would actively place now. So if you want to find out more about other types of filling materials and how we handle the removal process of amalgam fillings, you can visit our website at dentaldesigns.com.sg to find out more.